Thank you, Tina, for that introduction, and good afternoon to everyone wherever you're joining us from in Canada. Welcome back to our usual NCCEH Environmental and Public Health audience, and to those who are attending one of our National Collaborating Centre for Environmental Health seminar series presentations for the first time. This presentation today is building on some of the work that we did over the summer, which was looking at the risks of COVID-19 and precautions for choirs. We also presented in a webinar with Choral Canada in August, so I'll revisit some of that content today. But since then, we have had another look at the evidence for other types of performing arts as well. So today we'll be covering singing, acting, dance, and playing music in groups or band playing. I realize there's other areas of performing arts that may be touched on, but hopefully the general precautions and risks that we outlined today will have applicability towards a range of different applications. So I would just like to just get my slides moving there, point you towards our COVID-19 resources for environmental health that we have on our NCCEH website, and encourage you to have a look through there. As you can imagine, since the beginning of the pandemic, much of our usual work on environmental and public health issues has shifted focus towards COVID-19. And we've been helping to produce documents that improve understanding on things like routes of transmission in different settings, and helping to evaluate the effectiveness of different measures to reduce transmission based on the current evidence. Our website now has a range of ever-expanding collection, in fact, of COVID-19 related documents on transmission in settings such as indoor spaces, outdoor spaces, multi-unit residential buildings, encampments, and evaluation of some of the control measures such as masks, disinfection technologies, hand sanitizers, temperature scanners, partitions, ventilation, and it's growing every week. So please have a look at that today. You can also find the most recent document highlighted on the right there, which is the risks and precaution for performing arts, which we put up on the website last week. So if you haven't had a look at that yet, please go ahead. It will have much of the detail that I'm covering today, but also some additional information and all the references. So just a brief outline of what I'm going to cover. I'm going to have a look at some of the notable COVID-19 clusters and outbreaks that we've seen that have been associated with performing arts settings, and taking a look at understanding the transmission risks. So generally, as well as in respect to specific performing arts activities. I'll then have a look at some of the precautionary measures, and this is built on guidance that has been provided by a range of industry sectors, public health agencies, and also as evidenced from the literature and sort of the evolving research in this sector. And then we'll move on to a question and answer. So moving on to the notable COVID-19 clusters and outbreaks. And we know that the performing arts has been significantly impacted by this pandemic, whether it's individuals and groups that have seen their livelihoods disappear, venues that have had to shutter, and also people that participate on a volunteer, instructional, or non-professional level that have seen their activities curtailed. So we want to have an understanding of what has been behind sort of putting the brakes on here. So it really kicked off some of the concern about performing arts activities was the choir outbreaks that we saw very early in the pandemic. And I'm sure many of you have heard about the Washington State Skagit Valley event, where there was 53 out of 60 participants at a choir rehearsal that ended up becoming infected with COVID-19. And unfortunately, there was 2 deaths. Around about that time, there was also clusters and outbreaks in other countries that were related to choirs, both in France and Germany, as well as in the Netherlands. And when we look at those events, there was a high attack rate among participants. So that means the number of people that were exposed that resulted in an infection, it was quite high. And so that raised the alarm amongst the public health community to take notice and try and understand what was going on with transmission of this disease. When we look at other types of performing arts activities. I've just listed a couple here, but there's more in our full documents. We've seen a couple of Russian ballet companies where there's been significant outbreaks. In the Bolshoi Ballet, there was 34 cases identified, and that was among performers that actually didn't have any symptoms but were screened before a performance, and 34 of them were detected as positive for COVID-19. More recently, the Mariinsky Ballet in Russia as well, in St. Petersburg, there's been over 50 cases reporting that included dancers as well as coaches, and has resulted in some hospitalizations. And there was some precautions being taken amongst that group, such as limiting their outside contacts and a bit more awareness of the COVID-19 precautions, in contrast to the earlier ones in the choirs in March and February, where there was less public awareness of the COVID-19 precautions in these kind of settings. Theatres, we haven't seen as many reported outbreaks and clusters, and this could be because large venues have been closed and capacity limits haven't allowed for these venues to be operating. However, in Japan, there has been one notable outbreak that was reported for a small theatre in Tokyo, which had 186 seat capacity, but they were running on about 50% capacity. Over 5 days of performances and on exposures on different days, there ended up being about 30 cases among the staff, the cast, and theatre goers as well. So this was one of the few examples where we've actually seen that there is transmission to both the audience and the cast members too. As far as bands and instrumental outbreaks and clusters go, there's less information there that we have been able to find. In Japan, again, about 11% of 61 clusters up to, it was between April and July that they were measuring, were found to be associated with music-related events. And there was some events which were live concerts in small venues. So these were not arena-type concerts. They were quite small enclosed venues. We've also had reports of high school band outbreaks where they've had to stop high school band rehearsals. Touring metal bands that were returning from a European tour early in the pandemic, they also experienced a high rate of infection amongst those individuals, but it's hard to tie those down to something related specifically to bands or playing music. So what can we take from this? Well, we need to get a good understanding of the transmission risks, and some of this will be a bit of review for some of you, and hopefully it won't be too tedious, but we'll go through this. So what do we know about how COVID-19 transmits, or SARS-CoV-2, the virus responsible for the disease? And we know that it's transmitted via large respiratory droplets, and that's when you're in direct contact with somebody who has the infection and is sneezing or coughing, and you're exposed to their droplets, which we're talking about particles usually between 5 to 10 microns in diameter. There's also exposure from smaller respiratory droplets and aerosols, which could be from a direct close contact exposure, or could be indirect as well from accumulated aerosols in a space. And finally, contact with contaminated surfaces, so where some of these droplets or contaminated, somebody sneezed on their hands and touched a surface, and then somebody else touches that and touches their nose, mouth, or eyes. So this is fomite transmission. And if we just visualize that in a different way, the person on the left with the red outlined head could be the infected person, so to speak, and a burst of large droplets and aerosols presents a greater risk to people that are in close proximity, where you are more likely to pick up that droplet transmission and also a burst of the smaller aerosols. And at a further distance, you might, person on the far right there, end up being exposed by aerosols that can travel a little bit further. Also, that infected person may deposit their droplets on a surface, which can be touched by somebody, and then we have fomite transmission. And particle size is important in this, and there's really a continuum of particle sizes released during coughs and sneezes. So it's not as if a cough or sneeze releases only large droplets, it releases a range of sizes. And the graphic on the right there sort of gives you an indication of SARS-CoV virus particle is about 0.1 of a micron. And when we're looking at droplets, we're looking around about 5 to 10 and bigger. And aerosols are somewhere in between there, so less than 5 to 10 microns. And that's important for a few reasons. For large droplets, they have a quicker settling time because they are heavy and they will drop due to gravity. They're also less frequently released because coughs and sneezes are not frequent events, and they're more likely to be released by a symptomatic person. Aerosols, on the other hand, they may have an increased settling time, so they could travel a bit further. They can circulate and accumulate, and they can be released through coughs and sneezes, but also through other respiratory activities such as breathing, laughing, shouting, singing, etc. So those types of, and speaking, those types of activities are less intense, but they can be generated continuously. Therefore, aerosols can also be released by symptomatic people as well as asymptomatic people. And because they're smaller, they have a greater potential to reach the lower respiratory tract. If we look at outbreaks and clusters in other sectors, what we find are some commonalities in terms of where these events take place, as well as some of the characteristics of those places. And these two graphics on the bottom are looking at published outbreaks and clusters up to April. So that was quite early on in the pandemic. And on the right-hand side, we're looking at up to July, and that's in occupational settings. And many of these settings share characteristics of being indoors, being crowded, having a lot of close contacts and interactions between people, whether that's greeting, talking, laughing, cheering, shouting, etc., and sharing of food or objects, a long duration of interaction, so it's not a brief passing by, settings that have poor ventilation, and also it's important to note that these outbreaks and clusters occur where there is community spread of the virus as well. So if you have a low prevalence of the virus in your community, there's less chance that some of these settings will be higher risk. What is different with the events such as the choirs outbreak was when we look at the attack rate for some of those events, which was in excess of 80% of the people exposed became infected. In contrast, if we're looking at households, for example, the attack rate there is between 15 to 20%. So even though you're in a household with somebody who's infected, that's what we see as sort of this attack rate in those settings. So that's really why some of these performing arts settings appear to be more risky. But what are those transmission risks associated with performing arts? And so going to have a look in more detail at vocalization in terms of singing and acting, musical instruments, and dance. For all of these settings where there's gathering in groups for rehearsals or performances, there are inherent risks that were present in some of those other types of clusters and outbreaks. So where there's opportunities for close contact, whether that's group or partnered performance segments, and situations where actors, dancers, or singers have to share items or materials such as sheet music, props, stands, microphones, or dressing rooms, it's harder to maintain distance. So those are scenarios where you have closer contact. Those scenarios increase the risk of exposure to the respiratory droplets and short-range aerosols. So if we're looking at indoors over long durations, we also see increased risk of exposure to accumulated aerosols. So that could be settings such as dressing rooms, backstage. If you think about an orchestra pit, it's quite a low ceiling, enclosed type of room. And there's other types of rehearsal spaces that we see are also small enclosed areas. Limited ventilation reduces the dilution and dispersion of aerosols in these settings. And also where there's sharing of surfaces or objects, such as some of those listed earlier, not only does that increase the risk of close contact exposure to droplets and aerosols, but also increases the risk of exposure via fomites. So with vocalization during singing or acting, we know that vocalization affects both the quantity and the size of respiratory droplets and aerosols emitted. And there's been plenty of studies that have looked at this, that vocalization releases more than breathing, for example. It might release less than a cough or a sneeze, but if you have a continuous vocalization, such as singing in a group or some type of group activity where there's multiple persons as well, you increase sort of the source load there. And we also know from several studies that as the volume increases, the quantity of aerosols released increases as well. We know that type of the phonation and articulation can also affect the type and quantity of particles released. In addition to the quantity, the size is important because most of what is released during vocalization are aerosols, which are less than 5 to 10 microns, and the majority of these are less than 1 micron, so they're very small, meaning that they can remain suspended for longer, travel further, and be circulated in ambient air currents. And they're also much likely, as mentioned earlier, to penetrate the lower respiratory tract. This is just one example of a study that we looked at, which is from Merb et al. And they were using a laser particle counter to look at what we just talked about there, sort of the release of aerosols from different activities, including breathing, speaking, and singing. On the left-hand side in the red in the graphic, those were female singers, and on the right is male singers. And what we see in the 3 bars from the left is breathing, the middle bar is speaking, and the rightmost bar is singing. And as you can see, as there's a big difference between breathing and speaking or singing. There's been some contrary evidence in some studies that say that speaking produces less than singing, and other studies that say at the same volume they produce about the same. So there's a bit of discrepancy there, but we know that as the volume increases, the amount of aerosols released also increases. We also see that there was some variation between singers. This study found that there was higher emission rates for females versus males. It's a small sample size, and as you can see, it's not a very distinct difference between males and females. Some studies have found the opposite, so that's still a little bit unknown. Going back to articulation and phonation, this was just an example of a study that was looking at visualization of droplets while singing different types of notes. And on the left, we have fa from the do, re, mi, fa scale, and we see larger particles and more of them being released during that type of sound, which is like a hard consonant, as opposed to the so, which is on the right, which you can visualize there that there was less release during that. What this means really in terms of practice is hard to say, but it just builds up some of the evidence of where the particles and sources of aerosols might be coming. If we go to musical instruments now, and there's been quite a few studies that have looked at orchestras and release of particles and aerosols from different instruments. Of course, if we're looking at strings, keys, and percussion, pardon me, you're not releasing aerosols per se, but there could be potential for fomite transmission if there's a sharing of instruments. Some performers may perform quite energetically, and I can think of some drummers that I know personally that are quite energetic when they perform, and that type of vigorous exercise could potentially release more aerosols, and we'll talk about that a little bit more when we look at dance. As far as brass and woodwinds go, these are instruments where you're blowing air through them, so there definitely is particles being blown through the instruments, and that is coming out through the bell or the keys of the instrument. Current studies show contrary findings comparing different instrument types. Some say trumpets are better than flutes, and some say oboes are better than tubas, but it's not quite certain yet. But what we do know is that some properties of instruments, such as tube length, mouthpiece design, and the playing style, can affect the release of particles. For brass instruments in particular, the breath condensates. So this is liquid that builds up inside the tubing of the brass instrument, and they'll have a spit valve or a release valve where that is drained on a regular basis. that is a concentrated amount of respiratory fluid. And so if that is not carefully collected and disposed of, and it's either blown out forcefully onto the floor or into the area, there's a risk there that there could be some transmission via that substance. For dance, there has been less studies specifically looking at this. The clusters and outbreaks that we've seen in the literature has been where we get some of our information from, and those have been related to fitness classes, dance classes, ballet companies. And they could indicate that transmission could be due to a number of factors. The gathering in groups issue that we looked at earlier, the inside locations over long duration, close contacts, poor ventilation, and the physical exercise aspect of this. So while there's limited study specific to dance, we have seen some study that indicates that transmission risk due to vigorous exercise can increase the quantity and the velocity of air inhaled or exhaled. So if you are somebody with infection that is exhaling quicker and more, you may be loading more into the environment. Whereas if you're somebody who's susceptible to disease, if you're inhaling more rapidly and more air, you could be taking in a higher dose. Active movement can also increase air turbulence in the room and resuspension of settled droplets. There's an example of a squash court in Slovenia, which is mentioned in the full document, where the players that were infected, one player was infected, subsequent players used the same court. And despite never meeting or interacting physically, there was transmission to, in total, 5 cases. And there's some suggestion there that it could have been droplets suspended on the floor or just aerosols that were remaining in the squash court that could have led to transmission to people that used the court subsequently. So what can we really do about some of this? Have a look at some of the precautionary measures. First of all, it starts with every individual and the personal measures that they can take themselves to help reduce risk to themselves and exposure for others. So symptomatic or potentially exposed people basically should stay home. I think that's generally widespread advice. Same with high risk and susceptible persons, and limiting their access to or their risky situations that they put themselves in. Limiting social contacts outside of performance or rehearsal cohorts. So some groups are looking at this as, you know, you've got a production coming up, let's group ourselves into rehearsal or performance cohorts and limit our interactions outside of that group. So that includes social interactions outside as well as within the wider company. Taking precautions when you are outside of the group, including distancing, face coverings in public, and hand hygiene, all help protect the others. And avoiding those close contact scenarios, handshakes, sharing of objects and equipment, and doing preparation for events off-site. So that limits the need to be in small confined spaces or sharing of objects such as makeup or costumes, etc. Distancing is the rule that we all already know and are quite aware of, maintaining that 2-meter distance between everybody. So your performers, coaches, instructors, and the crew can help to reduce the spread due to large respiratory droplets. It can also help to reduce that short-range transmission of smaller droplets or aerosols. And the bigger the venue, the room, the easier it is to maintain that distance. It should be maintained in all areas. So that includes entry and exit points, warm-up spaces, washrooms as well if possible, or limiting the occupancy so that these spaces can avoid these close contact interactions. For wind instruments, the guidance suggests also taking into account the length of the instrument. So at the end of the bell of a trombone, for example, which could extend a fair distance from the individual, include that into your distancing calculation. For dancers and actors, it's not always easy if you have quite a dynamic performance or something like that. So looking at ways to make designated performance or practice zone can help to avoid those close encounters or accidental encounters, and keep people separate while still maintaining sort of the flow of a performance or rehearsal. Avoiding face-to-face arrangements is also important. Keeping people facing outwards or away is the best sort of arrangement. And that might mean coming up with some creative adaptations for scenes that require close contact. Some groups limit the persons from the same household to doing those close contacts, say joint dance segments or acting segments where the close contact can't be avoided. Next, we want to look at reducing the density of people and the duration we're spending in a space. So larger spaces and fewer faces is sort of the phrase that's being bandied about. But this can help to reduce the loading of infectious particles and increase the dilution and dispersion of accumulated aerosols. So this could be looking at how to adapt performances to solo performances, or again, forming these smaller cohorts or bubbles so that people don't interact outside of those, and it can reduce the exposure to the number of people. Shorter duration is also recommended, and breaks between rehearsal or performance, especially in smaller enclosed spaces. We're looking at 30 minutes is kind of a number that is used in a lot of guidance, but it's not a hard and fast rule for every location. Some jurisdictions use 15 minutes in Europe, whereas others don't have a limit. But just thinking about the space and the number of people in there can help to reduce that accumulation of potentially infectious particles. Also, when you're looking at maybe taking a break after 30 minutes or whatever time frame you decide, should be thinking about that break in a different location that does not then gather people somewhere else. So if we look back at the choir outbreak in Amsterdam, although the performers in the rehearsal and the performance were spaced out on the stage, in their coffee breaks, they were gathered in a lineup for coffee where they were interacting and they were in close contact with each other. In some cases, if you're lucky enough to have, for example, a school or a building where there's multiple rooms where you could rehearse, think about doing 30 minutes in one space and then moving into another space rather than maybe taking a break. So alternating between spaces is one option. And what about masks? Everybody wants to know about masks. Do they do anything? And yes, masks can block some emissions of droplets and reduce exposure to droplets and aerosols from others. The effectiveness of masks, however, depends on a number of things. So not all masks are created equal. And the key factors there are the fit and the filtration. So fit well without gaps around the nose bridge, chin, and sides, and filtration to effectively block the movement of both droplets and aerosols. So the thicker the material or multi-layers of material, it can help to reduce some of the movement of materials across that surface. Most of the homemade masks and some of the adaptations that we're seeing have not been assessed scientifically for their effectiveness. So the surgical masks or N95s that are approved for healthcare use, that's different. They've been tested against a certain standard, but a lot of the adaptations we're seeing now have not been assessed. And there are some specific to the performing arts, and some of you may have seen these already. So there's the singer's masks, and these are almost like a large duckbill type of shape that extend outward, and the purpose of the shape is to allow for greater articulation and mouth movement. For brass and woodwind players, there's been some suggestion that a normal surgical mask with a slit in the middle so that the mouthpiece can fit through and the player can still wear the mask while playing has been suggested, and that might be effective. Also looking at masks actually for the instruments themselves. So some groups now are looking at bell covers for the end of the instrument to block release of aerosols from the instrument directly. So masks should be considered as an added layer of protection along with the other measures. The International Coalition for Performing Arts has been looking at both singing and instrument playing and different types of measures, and I've just put a few graphics here to illustrate one of their studies that might be of interest. These are preliminary results, so these have not been published in any scientific journals yet, but over time you'll see more of this coming out from this group. This particular study is looking at particles of 0.5 to 20 microns that are released during singing of different types of singing, and then the effect of adding a mask while singing. And in this particular study, you can see in that top graphic that while singing hymns and pop songs, there's a fair number of aerosols released. Adding a mask helps to reduce that quite significantly in this particular study, almost down to the level of breathing, basically. In the graphic below that, this is more of a modeling study that looks at the risk to others from a singer wearing a mask. So if you look at the top row of those blue boxes, that models singing without a mask, and after 10 minutes, 30 minutes, and 60 minutes, you can see that the risk of infection for somebody in proximity of that singer increases. But in the row below, adding on the mask, the modeling suggests that wearing the mask reduces that risk quite a lot. Ventilation is another measure, and as we move into the winter season across Canada, using the outdoor environment as an alternative for our rehearsals and performance spaces becomes less feasible. But wherever possible, outdoors and uncrowded environments are the least risky environments because there's greater dilution and dispersion of aerosols and particles that make it less likely to accumulate an infectious dose worth of droplets and aerosols. As you become more confined and reduce ventilation, your risks increase. Even smaller indoor spaces where there is open windows are better than confined indoor spaces with no ventilation at all. And it is Canada and it gets cold in the winter, so opening windows becomes less feasible. So in these cases, we maybe want to consider less faces, fewer faces, larger spaces. So to reduce that kind of loading and accumulation of droplets and aerosols. As far as cleaning and disinfection goes, cleaning in routine cleaning and disinfection of shared surfaces, especially including dance bars and floors, is important, along with good hand hygiene, including cleaning and disinfection of shared equipment between users, or designating use of specific things just to one individual rather than sharing. Cleaning and disinfection of instrument surfaces and mouthpieces routinely is quite important, simply because you have a person blowing through, and we're talking about brass and wind instruments primarily here, but you have a player that is potentially blowing droplets and particles over the surface of an instrument. So that surface then becomes a potential fomite transmission route if others are touching that, as well as the player themselves are touching that instrument and then potentially touching surfaces such as doors, chairs, musical stands, etc. So instruments have their own specific sensitivities to cleaning products, and so recommended practice for the instrument for wiping down surfaces is suggested, and there is some links in our document on the website. For, as mentioned before, with the brass instrument, careful collection and disposal of the condensate within the instrument into a tub or a cloth that's disposed of, followed by hand washing and hand sanitizing to prevent that cross-contamination of surfaces that others could be exposed to. And when we're thinking about the performance space or the rehearsal space, floors are actually an important surface to be cleaning and disinfecting, not just your door handles, etc. So between groups, floor cleaning would be recommended. Although we don't go into detail for audiences here, because a lot of the recommendations for audience are specific to jurisdictions where there's set occupancy limits and workspace specific criteria. Some of the principles that are applicable everywhere, such as distancing, mask wearing, good hand hygiene, and respiratory etiquette, should be applied. Communicating with audiences prior to events can help to set out those safety protocols and what is expected of audiences, as well as how you are working to protect them. It can also allow for screening to recommend that people who have symptoms or have been exposed or may be highly susceptible to consider whether they should attend, and also to gather information for contact tracing. Some of the guidance, as mentioned, recommends discouraging audiences from participating in ways that result in vocalization as a group. So singing along, cheering, laughing, etc. And this can be quite hard when you're looking at a performing arts setting where people have come there to be entertained and to enjoy themselves. So to help along that route, but not add added risk, other suggestions for non-vocal participation could be made, such as providing them with handheld noisemakers, for example, or suggesting just clapping or other non-vocal types of expression. There's been a number of innovations in audience layouts and partitions and types of ways of setting out audiences to reduce crowding, reducing interactions between people, congregation points, separate exits and entrances, removing kiosks and food and drink services. But each of these is quite venue specific. Improving ventilation is also quite venue specific and might depend on what the venue is able to provide. But adding a layered approach can help to reduce risks. We've seen some studies that are emerging, and they're not published yet, that have looked at how audience move and interact. And there's a study out of Germany that provided, it had a volunteer audience of 1,500 participants that attended a concert and were put into 3 different groups, provided with fluorescent hand gel and contact trackers so that it could understand how audiences interact and what the potential transmission risks might have been. So when the results of that come out, that will help to inform what the risks are in audience settings. So just to summarize that, when we look at outbreaks and clusters in the performing arts sector, they do share common features related to gathering in groups and spaces we've seen in other sectors and other locations. The additional risk factors due to certain activities are those that increase the release of droplets and aerosols and can contribute to transmission in some settings due to vocalization, playing of wind instruments, or vigorous physical activity. When we're looking at precautions, we want to look at layering of precautions to reduce transmission risks. There are a number of risk assessment tools that are out there, and I'm just pointing you to a few that are here. The key principles of looking at risk are assessing the risk level of the participants. Are they aging, immunocompromised, or other? What is the risk level of the venue? Is it a small enclosed space? Is there ventilation, etc.? And looking at the risk level of the activity. And this is related to the number of people, what they are doing in the space, and the type of interactions that might be going on, as well as considering the level of community transmission and listening to your local public health advice as it may change. So the second stage, once you've looked at those risks, is to say, how could I mitigate some of those that you've identified? How to make it safer for certain participants, what you can do to either change to a larger, better ventilated venue, or to improve the situation in the venue you're at. And are there variations in the type, duration, nature of the activity that you want to engage in, either limiting the number of people, implementing mask wearing, spacing, or partitions. And finally, when you look at those mitigation measures, do they reduce your risk sufficiently? And if not, what else can be done? And if there's nothing else that can be done, is there need to consider whether you should be carrying on with that activity? This is one graphic that helps to kind of sum up some of that for you. And this is from a paper from Jones et al. Recently. And it's looking at the relative level of risk for high occupancy versus low occupancy venues, poorly ventilated versus well ventilated, and trying to look at the types of activities where there's no vocalization, where there's speaking, shouting, or singing, meaning louder vocalization, as well as the effect of wearing masks. So that's one way to maybe construct a risk matrix, but in every situation and every venue, it'll be slightly different. There is research also going on to use some of this to model and estimate overall level of risk. And I would just like to put a caveat that this data is used on results from previous outbreaks where the conditions were known, such as room size, number of occupants, number of infected persons, duration of exposure. But they are still a development, and as we learn more, some of those underlying factors and different outbreaks will help to refine the figures in here. I've listed 3, and these links are to calculators in the reference list, but what they do really is to say if I increase my ventilation or I reduce my occupancy, or if I move to a bigger venue, what might the level of risk to people in that venue be over a certain time period. And so it's interesting just to keep an eye on this. There's not really a firm sort of number that you can get out of here to say, if you do this, you'll be safe, but it helps to understand how different factors influence level of risk. So at that, I will pass us over now to the question and answer for a few minutes of questions.
Thanks so much, Juliet, for the informative and interesting presentation. So we'll move on to question and answer period then. So the first question that came in was about indoor versus outdoor performers. Are there any guidance for unregulated and regulated licensed street performers and buskers who perform outside or in city corridors like subway halls, etc.?
I haven't seen anything specific for outdoor performers, actually. Outdoors, as we know, is considered to be lower risk. I think if you look at something like the Edinburgh Festival, if people are aware of that, there's a lot of outdoor performance that happens there. And this year, a lot of the outdoor performers and street buskers were actually recommended not to come. And it wasn't necessarily because of the performance itself, it was because of the large number of people gathering and to try and reduce that crowding on the streets. Because if in some of these festival type environments, you have huge number of crowds. So the recommendations would really kind of link back to what your public health advice is locally in terms of gatherings and outside groups to make it safe. In terms of subway and sort of those types of venues, it would really depend on what the venue operator is saying is okay. But again, it's the same principles. You still there?
Hello.
Hello.
I have a question about directed ventilation. I've set up a situation in my own living room with a powerful fan blowing air out a door and another fan blowing air into the room, so that there's a single unidirectional flow of air. And it seems to me, if something like that have there been any tests of different kinds of ventilation to different situations, the relative safety of them?
Mm-hmm. So actually, there's a good document from the US EPA on indoor ventilation. They have some recommendations for household ventilation, similar to what you've just kind of described, where you've got sort of a flow through ventilation, where you've got one side of the room to the other. There's also been studies that have looked at, it does improve ventilation if you've got an open window on one side of the house and the other to create that kind of directional flow. If you're using fans, the important thing to consider it's different in your house because you'll know if the people in your house are exposed to COVID or have COVID. In a public space, the use of fans has to consider whether you're blowing infection from one person to the other. So they should be carefully placed to help the airflow and not increase exposure to some people on one side of the room.
Right.
So yeah, they can be effective to create that airflow, especially if you have, say, an open door on one side, the fan directing to an open window on the other side to clear. It's basically helping the air change rate where you don't have a natural ventilation or a mechanical ventilation system in place.
Thank you.
Welcome.
Okay, moving on to the next question. So just for future reference, we are only allowing chat box questions just for ease of management. If you have further questions, please feel free to type them into the chat box. Okay, moving on to the next question. This one is related to the outbreak and clusters chart, Julia, that you shared in one of your slides. Where would performer or performing arts venues fall under in these charts?
Okay, so on those charts, which I think we were looking at, I could open the slide again if you just give me a second. I'll just share that. Okay, so on the left-hand side, these events did not actually identify clusters of performing arts specifically. So some of the choirs were actually included in the religious settings, even though they weren't necessarily church activities. For whatever reason, in this particular study, they included the choir and church singing in these settings. For this particular study, they didn't include things like nightclubs and entertainment venues. And same on the right-hand side, those types of occupational settings were not included. So unfortunately, we don't have a series of studies that have specifically looked at sort of theaters, rehearsal spaces, orchestra spaces, etc. So unfortunately, I can't say exactly where we would sit in here. If you look at our document, which is on the website, we have a table in there that lists some notable, the literature reports of COVID-19 clusters and outbreaks associated with singing, dance, theaters, and bands. So you can get an idea of the numbers that we are seeing. Not everything is reported in media reports or the literature yet, so we don't know entirely. We know about sort of karaoke bars and nightclubs, and those are not exactly what we were looking at for performing arts settings. But have a look at that table in the document. That will give you a bit more detail.
Thanks. Okay, next one was about vocalization into microphones. Does that provide less risk than not?
Okay, so microphones is an interesting one. What some groups are recommending for microphones is the use of microphone covers, disposable foam microphone covers between people if you are sharing a microphone, or if possible to individually have your own microphones that you take away with you. When you're singing into a microphone, it's without some kind of a pop shield or block in front of you. There's no difference than singing without a microphone, essentially. So if you're singing close to somebody, there's still going to be release of droplets and aerosols potentially. So the precautions would be for distancing again, not singing directly towards somebody, potentially using microphone covers if you have a shared microphone, and consideration of things like pop shields in front.
Okay, thanks. Next question, should dancers maintain more than 2-meter distance?
So it's really not so much about the distancing, because we're talking about duration and the concentration of people in a space, which will be the issue really with dance, because there's a lot of moving around, and so aerosols will become dispersed within a space, and the longer you spend in the space, the more aerosols can accumulate, and the more people that are in that space that are potentially infected, the more dose that is being released. So it's not so much the distance as it is limiting the number of people and the duration spent in the space. And if you have these sort of designated performance spots that are maybe distance 2 meters, that helps in terms of reducing the large droplet exposure and that close contact exposure. Over a long period of time, though, that becomes less important, as it would be to, limit the numbers and limit the time spent.
Thanks. Next question, what is considered high ACH?
So ACH, we're looking at air changes per hour. And so on the graph, maybe I can go back to that one as well. When you're looking at this particular graphic, an ACH or air change per hour of more than 1 per hour or more than 10 per hour, there's a big difference in settlement of particles and removal of infectious aerosols potentially. So an air change or ACH of 10 is high, 1 is not very high. A lot of occupational settings, such as healthcare environments, are looking at 6 and above. Some are looking at 10 and above. On an airplane, you're looking at something around about 10 to 15 even. So they're very high. So something around about 1 would be low. I hope that answers the question.
Okay, thanks. Is there any evidence around the use of face shields or impermeable barriers versus masking in terms of transmission risk?
Sure. So with face shields, the issue there is that it can stop some of the forward projection of larger droplets. So if somebody is coughing or sneezing and they have a face shield on, that forward projection is blocked. However, with a face shield, most of them are open around the bottom and in the sides. So there is a downward movement of aerosols and potentially droplets there. So it doesn't stop release, but it might just block the speed and the distance that a larger droplet would be projected. So there's some adaptations of singers' masks where they have used a face shield where they've put a cloth barrier around the bottom of the face shield as an extra barrier to stop some of that release of droplets and aerosols from the bottom and from sort of the edges. These haven't been assessed yet for their effectiveness, so it's hard to say whether they do anything else. If somebody is using a face shield, consider it being as closed and contained as it can be, and actually face shields are generally not recommended without using a mask as well. So they don't replace the effectiveness of a mask, but they could maybe add to an added layer of protection.
Okay, thanks. Next question, with regard to instrument and bell coverings, what are the recommended fabrics for this purpose?
So there's no recommended specific fabrics as of yet, because they've not been assessed in great detail, but from some of the studies that we've seen so far, they've been using some type of a nylon. Some have used actual, ladies' nylons and put them over the bell cover where it's a small enough instrument to do that. Tubas maybe wouldn't work so great, but anything really that you would use for a cloth mask could also be used. It just depends on sort of the size and scale of the instrument that you're looking at. If you look at what the International Coalition of Performing Arts is coming out with, there's more details in their reports on what they were testing for bell covers. So watch this space, there will be more coming out, but any cover is better than nothing.
Okay, thanks for that. Next question. Ontario requires an impermeable barrier between singers, wind and brass players, and spectators. what are the reasonable dimensions for these barriers? There has been no information, and also must these be used for outdoor performances too?
Okay, so I haven't seen the specific details on what they're recommending for barriers, but there's a few principles when you're looking at barriers. First, you don't want them to cause an additional hazard that's going to, say, prevent an escape route or something in an emergency if you had to evacuate due to fire or something. So they shouldn't add extra risk. For some barriers, if they're suspended from the ceiling, they can cause a wafting, which can, kind of cause air or particles to kind of flow between. So thinking about how they're placed and how they're suspended or arranged is important. We have a blog on our website written by our colleague Angela Eichelbusch, who talks specifically about barriers and some of the principles for barriers. And that would be useful probably to have a look at. One of the things is to think about how the barrier is being used. If it's side by side versus somebody standing versus somebody sitting, there's considerations there for how air might be flowing around the person using them. So have a look at that. I hope that would give you some additional info. And as far as outdoors, I think I haven't seen anything about partitions being used outdoors specifically. In outdoor environments, we do have that greater level of ventilation. One caveat for outdoor spaces, and some of the International Coalition of Performing Arts had a look at this, which was using enclosed tents. So even though you're outside, if you're in an enclosed tent, thinking of that as actually more aligned to an indoor space, even though it might not be inside a building.
Okay, thanks. I think we have time for maybe one more question or two more. Do we have any information or research results on the viral load of aerosols and on how much viral load is needed to become infected?
Yeah, it's a really, really good question. And it's still something that's not completely understood within the scientific community. Most of the data that we have so far is on animal studies, and that is purely because of ethics. You can't be exposing humans to different doses of COVID and see how they react. So what we can see from the studies that are out so far is that it's probably going to be around about a few hundred to 1,000 particles to cause an infection, which is slightly less than for SARS-CoV-1, but more for some other infections. But there's a few things that have to be brought into play there. Some of that is to do with the susceptibility of the person. So not everyone will respond to a viral dose in exactly the same way, depending on their underlying health conditions or their size or their immunity, etc. So this is a space that we're still trying to understand. It's definitely more than one viral particle. So if you get exposed to one SARS-CoV viral particle, you're unlikely necessarily to get infected. So we're looking at a few. So if you're looking at what we know from the viral loads of people who do have the infection is that their viral load in the body is anywhere between 10 to the 6th, so that's 1 million viral particles per mil of fluid, up to 10 to 11. So you have some people who are super spreaders can release a lot more viral particles than others. Hopefully that kind of answers the question.
Thanks, Juliet. Unfortunately, we've run out of time to answer the rest of the questions. But if you would like to get in touch with me, I put my email address in the chat box. I can forward your inquiries to Juliet, and she will help to answer your questions. And thanks so much, everyone, for joining us today, and have a great rest of your day.
Thanks, everybody.